filling. Oh, are they doing amalgam? Are they doing amalgam? That looks like an amalgam carrier. Yo, how many stuff are in there? What's up everyone, my name is Dr. Mo and I'm a dentist. Today we will be watching together a tooth filling procedure. As you can see, there's no rubber dam on. I have other comments to see, so I'll be critiquing also the way that this procedure is done in here. Subscribe because more than 97% of people are not subscribed. It helps support the channel. Let's watch. Okay, so first of all, of course, the patient most likely was given local anesthesia, which is fine. You can see how the dentist is using very delicate light touches and movements as they're, I would assume, drilling and preparing the cavity. There's a high volume suction, and this is like an air water syringe to supply air and water when necessary, but I guess here it's used a bit slightly for retraction. So what they're using here is called a Toffel Meyer. It's a bit traditional. Of course, we have more advanced, we say, matrix systems. And what the dentist here is holding, this is called a wedge. They also need to place the wedge. So we have the Toffel Meyer, the wedge, and they push it in with a tweezer. And this appears to be, it looks like this, but actually I think this plastic instrument, maybe the other end, I couldn't see very well. Either it has a condenser or a burnisher. I guess what the dentist did here is they're trying to burnish actually not the tooth, but the metal surface there. Why we were taught in dental school to do this, to get a better contact area between the two teeth. Okay, so far is fine, but I will address the elephant in the room in a bit in relation to this filling. Oh, are they doing amalgam? Are they doing amalgam? That looks like an amalgam carrier. That looks like an amalgam carrier. Oh, it's so interesting. By the way, the video is really old, the one that I'm reacting to, so it's very possible that they're using amalgam, and as I said, they're, I guess, condensing that amalgam. And what you saw, that huge instrument used a bit ago, and yeah, this one. So that one carries the amalgam, and the dentist is given that instrument in order to continue. Very interesting, actually, an amalgam filling Toffel Meyer. By the way, Toffel Meyer is functional. It does the job, but it's traditional. There are, I would argue, better systems. Looks like there is some little bit of bleeding, if you can see on the explorer. Maybe the matrix was pushed a bit too deep into the gums, or maybe the gums were slightly inflamed as well, and friable, right? Meaning they could bleed quite easily. So they're going on, they wash the tooth. I guess they're adjusting the filling. Remember, with these amalgam silver fillings, they need to be carved and adjusted, and there's something called also as an amalgam burnisher. Also at the end, you can see that paper, so a floss to check the contact, really good. Then we have something called as an articulating paper. As you can see, the patient is biting on it to check the occlusion, and if there's any high points, again, instruments to carve and adjust the amalgam filling. That is a low volume suction, at least what appears to be. We have similar ones called a low volume suction mirror, just to see the area well. As you can see, there's also a cotton roll on the outside the tooth surface. We call that in the buccal area between the lips and the tooth. The reason is they use that for isolation. Of course, more advanced methods we have right now, such as the rubber dam, if you heard about it, we're reaching the final steps. They're adjusting the occlusion. Things do look good, and to adjust the occlusion, as I said, they check with that articulating paper. I guess that's all for today. Don't forget to like, and subscribe to the channel. Check out there's playlists and similar videos to this that I have on my channel. Dr. Mo Dentist out.